Alright, in this video, we'll be doing the empty can test. The empty can test is the test for the supraspinatus. So to start this test, you'd want to put your patient in 90 degrees of shoulder flexion and then 30 degrees of horizontal abduction. Then you're going to have your patient point their thumbs down and you're going to apply a distal downward force. If patient presents with pain or weakness compared to the other side, then this is a positive test. In this video, we'll be doing the full can test, testing for the supraspinatus. So for the full can test, I'm going to have my patient go into 90 degrees of shoulder flexion and 30 degrees of horizontal abduction with having their thumb up. For this test, I'm just going to apply a distal downward force and I'm going to ask them to resist. Resist. Okay, you're good. A positive test would indicate pain or weakness compared to the other side. In this video, we'll be doing the external rotation in zero position test. For this test is going to test the supraspinatus and the infraspinatus. So to start this test, you're going to have your patient seated. You're going to have them their elbows at 90 degrees with their elbows close to their core. Then you want to stabilize the elbow. You want to keep them here and you want to tell them to push outward against your hand. A positive test would indicate pain or weakness compared to the other side. For the external rotation in zero position test, it's a really good test to determine if a patient has a rotator cuff tear or shoulder impingement. So if you do the internal rotation test in the zero, drop arm, and painful arc, there's a 91% chance that they have a full thickness rotator cuff tear. And if you do the Hawkins-Kennedy external rotation zero and you do the painful arc, there's a 95 likelihood that they have a shoulder impingement. In this video, we'll be doing the drop arm sign test for the supra and infraspinatus. For this test, we're going to have the patient I'm going to put the patient into 90 degrees of shoulder abduction. And then I'm going to let go, but I'm going to tell him to drop your arm in a controlled manner. A positive sign would indicate that if I asked Brian to drop his arm in a controlled manner and he wasn't able to and it just dropped, then that would be a positive sign. The drop arm sign test is a good test for a rotator cuff tear. If you test positive for external rotation in the zero position, drop arm, and painful arc, you have a 91% likelihood of a full thickness rotator cuff tear. In this video, we'll be doing the external rotation, lag sign, and 90-90. So this test is for the infraspinatus and the teres minor. So to start this test, I'm going to put my patient into 90-90 position. 90 degrees of shoulder abduction and 90 degrees of elbow flexion. Then I'm going to put them into external rotation. Once I put them external rotation, I'm going to communicate to my patient that, Brian, I'm going to spontaneously let go of your arm and keep in this position. Because Brian was able to keep it in this position, he has a negative test. If I would do the same thing and then I were to let go Brian, now I'm going to let go whenever, keep in this position, and then they were to go into internal rotation, that would be a positive test. In this video, we'll be doing the internal rotation lag sign test. So the internal rotation lag sign test is a special test for the subscapularis. So to do this test, I'm going to have my patient turn around. Turn around, Brian, please. And let's say that this shoulder is Brian's impaired shoulder. So I'm going to put him here with his dorsum of his hand on his lumbar spine. Then I'm going to lift it off his back. And then I'm gonna tell Brian, I'm going to randomly let go. When I let go, keep your hand there. Okay. All right. So Brian's able to keep his hand, the dorsum of his hand, off his back. Okay. Relax now. So I'm gonna show you a positive test. A positive test is that I do the same thing, but Brian, I'm gonna randomly let go. And once I let go, Brian's hand goes directly on the back of his goes on his back again. In this video, we'll be doing the lift-off test for the subscapularis. Okay, so to do this test, I'm gonna have you turn around, Brian. Okay. So for lift-off test, I'm just gonna put the patient is gonna put his hand on his back, and then I'm gonna show him what he's gonna do. So I'm gonna have you take your hand and lift it off. Okay, go ahead. All right, good. So Brian has a negative. Brian tests negative. If Brian were to test positive, then if I ask Brian, take your hand off your back, and he was unable to, then that would be a positive test. In today's video, we'll be doing the speeds test. The speeds test is used to determine if the patient has a slap tear or has a long-headed biceps lesion. So to do this test, there's a couple ways to do this test, but the way I like to do it is I'm going to bring my patient to 90 degrees of shoulder flexion, have their palms facing the ceiling, and then I'm going to tell them I'm going to apply a downward force. Okay, apply a downward force. All right. So Brian tests negative. The reason Brian tests negative is because he didn't report of pain to the anterior part of his shoulder. If I were to do this test again on Brian, and he reports pain, so like he says, "Oh, ow," then Brian will have a positive test. All right, in this video, we'll be doing the Yergason test. The Yergason test is a shoulder specialist test to determine if a patient has a lesion in the following things: the transverse humeral ligament, long-headed biceps, or slap tear lesion. So to start this test, you're gonna have your patient sitting, and then you would put their elbow 90 degrees, and you would go into kind of a handshake position, and you want to palpate the bicep tendon. Thank you. So you're looking for two things. So Joey, I'm gonna have you try to supinate your hand, and then go against my resistance. All right. As we're doing this, right, you're feeling if there's a pop in the biceps tendon. If there's a pop in the biceps tendon, then there's a lesion in the transverse humeral ligament. If there's no pop, but Joey experienced pain, so resist against my hand, then there's two things: either a slap tear lesion or a lesion in the long-headed biceps. Today we'll be doing the Ludington test. The Ludington test is used to determine if the biceps long head is ruptured. So the way you do the Ludington test is first you go behind the patient. Brian, I'm going to have you put your hands on the back of your head and interlock your fingers. Okay. So I'm going to palpate the long head of the biceps. So when I'm and I'm going to have Brian flex. So Brian flex. Okay. So what I'm looking for, you can relax, Brian, is that if there's no contraction or there's some sort of asymmetry. If there's no contraction or there's some sort of asymmetry, then that's a positive test. If there's not, so Brian flex, there's no asymmetry, I felt the contraction, then Brian has a negative test. In this video, we'll be doing the Hawkins test. The Hawkins test is to determine if a patient has subacromial pain or if they have shoulder impingement. So the way you do this test is I'm going to take the patient's arm, I'm going to stabilize at the elbow, and then I'm going to passively, so Brian, I'll be doing everything, you're not doing anything, and I'm going to passively at the wrist put an internal rotation. Okay. So a positive test is that if I'm doing this and Brian has pain, so Brian will be like, ow, then that would be a positive test. So today we'll be doing the Neer test. The Neer test is a special test to determine if a patient has subacromial pain or shoulder impingement. So the way we're going to perform this test is first, you want to depress the scapula with one hand, bring it down. Then I'm going to passively put my patient to internal rotation. And I'm going to bring them to shoulder flexion as much as they can. Okay. So Brian tests negative. The reason Brian tests negative is because he had no reproduction of pain. If I were to do this test on Brian and I was going up and he was like, ow, then that would be a positive test. In today's video, we'll be doing the painful arc test. The painful arc test is to determine two things: subacromial pain and AC joint pain. So the way you do this test is that for painful arc, so first you want to show the patient what to do. So like you're doing a snowman, going like this. Okay. So I'm gonna have you do that. All right, good. So look, Brian was able to do this with no pain. If Brian were to have pain anywhere between the 160 and 60 degrees and 120 degree mark, so around like this area, and he was like, ow, then that would be for subacromial. If he were to have pain anywhere between the 170 and 180, ow, then that would be AC joint. You can put your arms down. So for the painful arc test, it's a really good test for two things: rotator cuff and shoulder impingement. If you test positive for the painful arc test with two other tests, which are external rotation in the zero position and drop arm, you have a 91% likelihood of a rotator cuff tear. If you test positive with the Hawkins Kennedy, external rotation, and the painful arc test, then you have a 95% likelihood of a shoulder impingement. In today's video, we're going to go over the Yocum's test. The Yocum's test is used to determine if a patient has subacromial pain or shoulder impingement. So the way we're going to do this test is that, for example, if Brian has left shoulder pain, right, we're going to take his left hand and we're going to put on his opposite shoulder. I'm going to have him bring his arm up a little bit, and I'm going to tell Brian, during this test, try not to lift your shoulder up, okay? I'm going to apply a downward resistance to Brian's elbow. All right, Brian, resist against my, resist. Okay, good. So what I'm looking for is if there's pain or weakness, that'll be a positive test. All right, today we'll be doing the jerk test. The jerk test is to determine if a patient has a posterior inferior labral tear. So to do the test, first you have your patient sitting, and then you just go right behind your patient. And then I'm going to have her go into 90 degrees of shoulder abduction with 90 degrees of elbow flexion. And then you could either stabilize at the other shoulder or the same shoulder, depends on the patient. So for me, I feel more comfortable stabilizing her here. I'm going to apply an axial load, and I'm going to bring her into horizontal adduction. Okay. And a positive test, you can put your arm down. A positive test will be reproduction of pain or reproducible clicking. All right. In this video, I'm going to show you the O'Brien's test. The O'Brien's test is used to determine if a patient has a slap tear or a bicep tendinopathy. Damn, I can't. Tendinopathy. Today we'll be doing the O'Brien's test. The O'Brien's test is to determine if a patient has a slap tear or a biceps tendinopathy. So to do the the O'Brien's test, first I'll have my patient go into internal rotation, then I'll apply a downward force while she's resisting. Okay, good. And Alana has no pain. Then I'll have her go into external rotation, and I'll apply a downward force, and she has no pain. You put your arm down. A positive test is that she had more pain in internal rotation than she did in external rotation. The two tests that you would do to determine if a patient has a slap tear is the passive distraction test and the O'Brien's test. All right, so we're going to be doing the crank test. The crank test is to determine if the patient has a slap tear. All right, so what I'm going to do, I'm going to bring my patient into 160 degrees of shoulder abduction, then 90 degrees of elbow flexion, and then I'm going to provide an axial load, and I'm going to bring them into internal and external rotation. A positive test would be if there's reproduction of pain or reproducible clicking. Okay, good. So in this video, we'll be going over the compression rotation test. So the compression rotation test is for a slap tear and a labral tear. So for this test, I'll bring my patient into 90 degrees of shoulder abduction and 90 degrees of elbow flexion. And I'm going to provide an axial load. I'm going to bring them into internal and external rotation repeatedly. If the patient presents with pain or there's reproducible clicking, then that would be a positive test. Okay, good. In this video, we'll be going over the passive distraction test. This test is used to determine if a patient has a slap tear. So for this test, take the patient's arm, bring it over here with their palms up. Then I'm going to distract and bring her into pronation. So a positive test would be that if the patient has reproduction of pain or there's reproducible clicking. In this video, I'll be showing you the apprehension test. The apprehension test is a shoulder special test to test for if the patient has anterior instability. So to do this test, you'll first have your patient lie in supine, lay down. Then you'll put them in a 90-90 position. So here. And then you want to put them into external rotation with caution. And you're looking for if the patient has any pain or subluxation. All right, so Joey is negative. If Joey was positive, then as I would be putting him in external rotation, he would be saying something like stop, or he wouldn't let me go anymore. In this video, we'll be doing the relocation test. The relocation test is a shoulder special test to determine if the patient has anterior instability. So this test is a continuation of the apprehension test. So to do this test, I'll have my patient lay down supine. And similar to the apprehension test, we're going to have them in 90-90 position. And then for the relocation test, you just want to apply a anterior posterior force on the glenohumeral. And then we want to put them in external rotation. And if the pain is relieved with the anterior posterior pressure, then that's a positive test. In this video, we'll be doing the load and shift test. The load and shift test is a shoulder special test to test if the patient has anterior or posterior instability. So the way that you want to do this test is have your patient sitting. I'm just going to sit right beside him for video purposes. Have him make sure he has good posture. So he has good posture. So for this test, there's two parts. There's a load part and there's a shift part. So what you want to do is you want to stabilize the scapula and clavicle with one hand. And with the other hand, you want to grasp the glenohumeral. All right, so once you grasp it, that's the loading part. And you want to put it into the glenoid fossa. The shift part would be translating it anteriorly and posteriorly. So it would be anterior, posterior. A positive test will be excessive translation compared to his other shoulder. All right. For this test, we'll be doing the Sulcus test. The Sulcus test is a shoulder special test to test if your patient has inferior instability. So the way that you want to do this, you could have your patient standing or sitting, and then you want to make sure they have good posture and ask them to relax their shoulder muscles. So just relax. And then you want to use your one hand to stabilize. And then you want to grasp the distal end of the humerus, and then you want to pull downward. So what I'm looking for is some sort of divot near the shoulder. If there's a divot or some sort of subluxation, then it's a positive test.